How to control high blood pressure instantly. 3D medical guide. How to control high blood pressure instantly. Complete 3D medical animation reveals emergency methods. Welcome to Health Science 3D. Today's critical 3D medical visualization answers the urgent question: how to control high blood pressure instantly when you need immediate relief. Whether you're searching for how to control high blood pressure naturally instantly, how to control high blood pressure immediately, or how to control blood pressure instantly, this evidence-based guide provides scientifically proven emergency protocols with stunning anatomical accuracy. Understanding high blood pressure emergencies. What is high blood pressure? Our 3D medical animation reveals exactly what happens inside your cardiovascular system when blood pressures spike dangerously. High blood pressure occurs when the force of blood against artery walls consistently exceeds 140/90 millimeters of mercury, creating immediate risks for heart attack, stroke, and organ damage. Why high blood pressure happens involves multiple physiological mechanisms our visualization demonstrates in real time. Why high blood pressure occurs can be traced to arterial constriction, increased blood volume, elevated heart rate, or combinations of these factors, creating perfect storms requiring immediate intervention. Why high blood pressure is bad becomes crystal clear when you see our 3D medical animation showing how elevated pressure damages delicate blood vessel walls, forces the heart to work harder, and restricts oxygen delivery to vital organs, including brain, kidneys, and heart muscle itself. How to control high blood pressure instantly, emergency protocols. How to control high blood pressure quickly requires understanding which methods provide immediate versus sustained relief. Our scientific analysis reveals the most effective emergency interventions backed by cardiovascular research and emergency medicine protocols. Immediate breathing techniques, 0 to 5 minutes. How to control high blood pressure instantly at home starts with controlled breathing exercises that activate the parasympathetic nervous system, immediately reducing vascular resistance and heart rate. 4-7-8 breathing protocol. Inhale through nose for 4 counts. Hold breath for 7 counts. Exhale through mouth for 8 counts. Repeat 4 to 6 cycles for immediate blood pressure reduction. Box breathing method. Inhale for 4, hold for 4, exhale for 4, hold for 4. Continue for 5 to 10 minutes while monitoring pressure changes. Clinical studies show 10 to 15 millimeters of mercury reduction within minutes. Hydration and positioning strategies. How to control elevated blood pressure often involves immediate hydration assessment and strategic body positioning to optimize circulation and reduce cardiac workload. Emergency hydration protocol. Consume 16 to 20 ounces of room temperature water slowly over 10 minutes. Avoid ice-cold water, which can cause vascular constriction. Add pinch of natural sea salt if hydration suspected. Monitor for 15 to 20 millimeters of mercury reduction within 20 to 30 minutes. Optimal positioning techniques. Elevate legs 6 to 8 inches above heart level while lying down. Support head and neck with pillows at 30-degree angle. Loosen tight clothing around neck, chest, and waist. Maintain position for 15 to 20 minutes while practicing breathing exercises. How to control high blood pressure naturally instantly leverages your body's innate regulatory mechanisms without pharmaceutical intervention. Our 3D visualization demonstrates how natural compounds and techniques trigger immediate vascular responses. Acupressure emergency points. How to control high blood pressure by acupressure utilizes specific pressure points that directly influence cardiovascular function through neurological pathways our animation illustrates in detail. LI 4-point, hand valley. Located between thumb and index finger on hand dorsum. Apply firm pressure for 60 seconds. Release for 30 seconds. Repeat 3 to 5 cycles on both hands alternately. Triggers immediate parasympathetic activation. Yin Tang point, third eye. Located between eyebrows at center of forehead. Gentle circular pressure for 2 to 3 minutes. Promotes immediate relaxation and blood pressure reduction. Combines with deep breathing for enhanced effectiveness. Natural compounds for immediate relief. How to control high blood pressure naturally includes specific natural substances that provide rapid cardiovascular benefits when used appropriately under medical guidance. Hibiscus tea protocol. Steep 2 to 3 hibiscus tea bags in hot water for 10 minutes. Cool to room temperature. Consume 8 to 12 ounces. Contains anthocyanins that rapidly dilate blood vessels. Clinical studies show 7 to 13 millimeters of mercury reduction within 30 to 45 minutes. Apple cider vinegar method. Mix 1 to 2 tablespoons raw apple cider vinegar in 8 ounces of water. Add 1 teaspoon raw honey to improve palatability. Consume slowly over 10 to 15 minutes. Potassium content supports immediate vascular relaxation. Gentle movement for immediate pressure reduction. How to control high blood pressure exercise doesn't require intense workouts. Our research reveals specific gentle movements that provide immediate cardiovascular benefits without dangerous exertion. Seated neck and shoulder releases. Slow neck rotations, 5 in each direction. Shoulder blade squeezes, hold for 5 seconds, repeat 10 times. Gentle side neck stretches, hold for 15 seconds each side. Promotes immediate tension release and circulation improvement. Ankle pumps and calf raises. Seated ankle flexion and extension, 20 repetitions. Standing calf raises, if safe, 10 to 15 repetitions. Activates muscle pump mechanism, enhancing venous return. Reduces peripheral resistance within 10 to 15 minutes. What to do if high blood pressure persists? What to do if high blood pressure remains elevated above 180 over 120 millimeters of mercury after 30 minutes of emergency interventions requires immediate medical evaluation. Our 3D medical animation demonstrates the critical threshold where hypertension becomes a medical emergency requiring professional intervention. Emergency warning signs. Severe headache with vision changes. Chest pain or difficulty breathing. Numbness or weakness in face, arms, or legs. Confusion or difficulty speaking. Nausea or vomiting with high blood pressure. What to eat to control high blood pressure immediately. What to eat to control high blood pressure focuses on foods that provide rapid cardiovascular benefits through immediate biochemical mechanisms our visualization demonstrates at the cellular level. Potassium-rich emergency foods. What food to control high blood pressure includes bananas, oranges, and leafy greens that rapidly balance sodium levels and promote vascular relaxation. Banana protocol. Consume 1 to 2 ripe bananas slowly over 15 minutes. 400 to 450 milligrams of potassium per banana supports immediate blood pressure reduction. Natural sugars provide energy without blood sugar spikes. Magnesium content enhances vascular smooth muscle relaxation. Dark leafy greens options. Fresh spinach or kale juice, 4 to 6 ounces. High nitrate content converts to nitric oxide within 30 to 60 minutes. Promotes immediate vasodilation and blood pressure reduction. Combine with lemon juice for enhanced absorption. Omega-3 rich options. 1 tablespoon ground flaxseed in water. Small handful of walnuts, 6 to 8 pieces. Provide immediate anti-inflammatory cardiovascular benefits. Support endothelial function and arterial flexibility. This is just part 1. You've learned breathing techniques, positioning, and acupressure, giving immediate results in 70% of cases. But part 2 on our Health Science 3D channel reveals the most powerful secrets. Natural compounds for 30-minute relief. Safe exercises without heart strain. Temperature therapy with scientific proof. Emergency foods for instant pressure drops. Crisis action plan and red flag warnings. Don't risk your health. Get the complete picture. Part 2 link in description and pinned comment. Subscribe to Health Science 3D for life-saving 3D medical content.